train as a doctor anywhere in the world, you learn the same anatomy and physiology, drugs all work in the same way. But what's different is the professional culture that you join as a doctor, and the communities and cultures within which you work.
Medicine is everywhere the same, to be honest. You read the book and you apply it in practice, but for me the hospital setting, communication with your colleagues, medical staff and with the patient was main things that I had to focus on and improve.
The communication is difficult because not everyone is like Bill Clinton and Tony Blair and good at delivery. That will take time. So I think that, again, it's all about exposure, experience, watching, learning, and taking things forward.
Seeing other doctors, it helps me tremendously because you see even the languages that they use, languages with the patient, languages with their colleagues, because I think always I'll be learning English, always.
Good morning, Mr. Hoffman. Dr. Gupta, I think we met in the clinic some time ago, but I know that we've brought you into hospital this time.
The best of doctors see themselves as servants of their patients. The idea of really having to explain to a patient, support them in making choices, negotiating compromises between what you would like to do as a doctor and what they will allow you to do as a patient, is a whole set of skills which they're not used to using in a medical context.
Answering all their concerns and their questions, that's a huge difference. It's not in my country. It still is not in my country.
We have discussed with the surgeons about an operation now for the valve. What do you think about that? Do you feel
I'm quite happy.
you're quite happy? Patients will often say their views about whether they want an operation or not, and we must respect that. We can try and weigh up the risks and benefits of all of our treatments with them, but if they've got capacity, they understand, we should allow for that as well.
The evidence is that when things go wrong, it's usually not language or grammar that's the problem. It's actually body language, eye contact, the whole almost unconscious way in which you respond to a patient.
I can see that our body language is different from other countries. I had an Indian, a friend of mine is an Indian colleague. He used to, if I asked him a question and the answer was yes, he would do like that.
What I learned in this country is to be careful when you approach people, because some people, they don't like to be touched.
In some cultures, it's actually not polite to look at someone's eyes, and it feels very confrontational. How close you stand to somebody, how loudly you speak, how you interrupt people during a conversation, how you pass a conversation backwards and forwards, are all very deeply cultural things which it takes a long time to learn.
Here it's multidisciplinary teams. Here is the involvement of paramedics, not just doctors, often the patients. We've got physiotherapists, we've got nurse specialists, we've got pharmacists.
Team communication is very, very effective and nice. There is like the nurses, the physiotherapists, occupational therapists, all the team is involved in the care of a patient, and they have a very good and effective way of communication.
British society has changed a lot as well, particularly in medicine. Authority is not age and where you trained. It's how up to date you are and how intelligent you are at interpreting results and arguing your case.
We don't disagree with our seniors in our countries. That's why I call it a privilege. And
I think it's not so much about agreeing or disagreeing, really. Often it's about being able to put a point of view over and have it heard.
I've seen that if the consultant has got 5-10 minutes time, he's asking everyone from nurse to the junior doctors and upper grades if they want any tea, any coffee. He's going to make tea for the staff. And when I was first noticed this, I was shocked at how come, and I was saying no, thank you, no. I didn't know the culture.
But in the NHS, it's actually all right to admit that you don't know.
Exactly.
And in fact, the most important thing is knowing what you don't know and then knowing who to ask for help. My first contact with the Building Bridges programme was actually attending an event at Whipps Cross Hospital. And I know that both Whipps Cross and Newham have been involved for some years in providing placements for refugee doctors. And that really has been absolutely vital.
So you can go on a course, you can sit in a meeting, you can observe. It's only when you get out there. It's a bit like delivering a lecture. In the early days, we used to spit and stutter and stammer. If you do enough of them, it gets better.
What I find it amazing is applying the medical knowledge, no matter what the level is, by sharing and communicating and helping each other.
The way they communicate with patients is amazing to see how do they communicate, and those things, to be honest, is lacking in our culture, and we don't have that much emphasis on that.
But being in that hospital for 1 month has boosted my confidence hugely and tremendously. And I know now where I'm standing, and I know that where I fit into the NHS system.
We've got a huge resource of refugee doctors in this country, which at the moment we may not be using as well as we could because of some of the formalities of getting registered and getting them into the system. And any way that we can bring these people on stream quickly would be of great advantage to this country as well as to them.
Yeah.